Hey, my name is Dana, and I've been working on a COVID unit in New Orleans since this started. And I know there's a lot of very divisive discussions about opening things back up, whether or not the virus is a hoax, and things like that. So I just wanted to maybe offer my personal experiences and just maybe some advice as we move into reopening our the economy and quote unquote non-essential businesses. So first of all, the virus is not a hoax. It is nothing nice. I will tell you that. It's very serious, and as we start to open things back up, I truly hope we don't get a second wave of infection. What I will say is I've seen the youngest we had on the ventilator at my facility was 18, all the way up to 60, 70, 80 years old. Also, I've seen people die of the flu, and I've seen people die of the coronavirus, and they are not the same thing whatsoever. Not the same. Especially with with the fact that you cannot see your family members. You're in isolation. The nurses, the staff, we're not, you know, staying in the room for as long as maybe we normally would. And then even if we do, we're covered from head to toe in protective equipment, so you can't really see us, just our eyes. Now, as far as PPE is concerned, I've been very fortunate. I get a new hazmat suit every shift, a new surgical mask, and a new N95. Sometimes they have shoe coverings and head coverings, sometimes they don't. And you get the one suit and you wear that for your entire shift. And that has not been the case in some other places. So in New Orleans, I have been fortunate with the PPE that I am provided. Though it may not be ideal, it's still better than some other places. They've We've had so many people waiting in the ER with COVID that as soon as you lose somebody, someone else comes back up. So it's just been constant, nonstop. We do have the refrigerated cooler trucks out back. That is probably the worst thing that I've seen or done, is when I had to put my patient on the cooler truck because there was no more room in the morgue. And yeah, that was pretty humbling experience. At one point, we had so many codes going on. I want to say there were 3 or 4 codes going on at the same exact time throughout the hospital with COVID patients. We don't have the staff to code that many people at the same time. So, you got to make a decision on who you can save and who you can't. Um, so, take it seriously. It is serious. Um, Obviously, if you have any other life-threatening symptoms, strokes, heart attacks, you still need to go to the ER for anything that you have at home that's life-threatening, with shortness of breath, dizziness, high fever, severe pain, things like that. Don't avoid the ER if you have a life-threatening symptoms. On the other flip side, the nice thing is we aren't seeing the people that abuse the ER. I'm not advocating for you not to seek medical treatment. Don't take that the wrong way. Something interesting too is that they have been posting on the coronavirus some things that they're figuring out with the way that it clots your blood. And I have noticed that with my patients. The last shift I worked, 3 out of my 5 patients were fresh stroke patients. So that is very interesting to see how that progresses. Maybe you didn't get the severe respiratory symptoms initially, but then we're starting to see people that progressed into heart attack or stroke symptoms from the coronavirus. So I'm really interested to see all the research that comes out. And really we don't know how to treat it yet. I'm going to be 100% with you. So if you get the coronavirus, we're still kind of guessing on how to treat you. Obviously, I mean, we're not just randomly doing things, but we still don't have a 100% foolproof treatment. So there's that. I do understand it's financially hard on a lot of people, these lockdowns. I'm not totally against reopening things, but I think it needs to be done systemically. It needs to be done efficiently. It needs to be done safely. Some problems that I potentially see with reopening things is the fact that schools are still closed. So then you have parents with not a lot of daycare options that aren't going to be able to go back to work because school is closed and they have their children at home. You also have people that are high risk to catch the virus that are immunocompromised, or they take care of family members that are immunocompromised. Those people may not be willing to go back to work for their own health concerns. The problem with that is if they're required to go back to work, then they're going to be getting fired if they don't show up. So there's a lot of things that need to be taken into consideration as we consider opening things back up. Also, as they open things back up, I still wouldn't go out for something that could wait or is non-essential. I wouldn't start to do personal travel or anything like that. Some things you can do as we start going back to work, obviously wash your hands anytime you think about it or get an opportunity to do it. There's a lot of great hand washing videos that have come out since this thing started, so please go look those up and implement them. I've had to teach my own family members how to wash their hands since this started. Properly wash them. Masks, homemade masks if you get your hand on them. Surgical masks, do not touch your mask or your face. I take them on and off just with the elastic around my ears. Taking off your clothes in the garage, in your backyard, not wearing them into the house if you've gone out and about, promptly washing them. I don't wear my shoes in the house that I've worn to work, and I spray them down with a disinfectant. You could put a trash bag or a towel or a blanket over your car seat so that you're not directly sitting on your car seat after you've gone out and about if you're required to go back to work. What else can I think of? Usually in the hospital, only people that work in labor and delivery or surgery services, things like that, will wear head coverings. But since this started, we have all been trying to cover our hair and our heads as best we can with medical scrub caps, bandanas, old t-shirts, anything, just to keep your head and your hair covered. I think... trying to think and see if I have any other tips that you can follow as you're going out to work. A lot of grocery stores in my area have been really great on having one-way aisles, spacing people out as they're standing in line. So this is really the time for businesses, employers to start brainstorming maybe better ways to do things from here on out to keep people safe. So like I said, I understand the financial hardships and the personal hardships that some people are facing with abuse, depression, suicide, and not having anything to eat, not being able to pay their bills. But the virus is also serious. So it's really a lose-lose situation here, but I don't think we should take a Hunger Games approach to this, every man for himself, survival of the fittest. That's not the way to do it. So just as we have these discussions, stay safe, stay healthy, stay hydrated, stay active, take care of yourself, be smart, and continue to check on other people, show them that you care, look for signs and symptoms that they may be struggling, and just really, this is a time for humanity to really show the best part of ourselves, to each other, to ourselves. Take care of your mental health, your physical health. And I think that's all I have for now. I know this sounds really random and confusing, and I'm sorry, I'm not a professional speaker or writer or anything. I'm just a nurse, not just a nurse, but I'm hoping this can encourage people and to number one, take the virus seriously, but number two, as you start to open things up and businesses up in your community, to still stay safe. So thank you for watching. Feel free to share and stay safe, stay healthy, stay blessed.